As we consider the burden of disease among adolescents, it's important to elaborate on a number of the specific issues that came up in the last graphic, and even in the ones before that. And I'm going to comment just briefly on them, but I encourage all of you to explore further on your own these really important issues and how they relate to adolescent health. Early pregnancy and childbirth are really fundamental to adolescent health. I'm sure everyone understands that the maternal deaths, that women are at greatest risk of a maternal death at very young ages or relatively older ages as well. And we're living in a world in which about 11% of all births occur among adolescents. And by the time women are 18, about 20% of all women by the time they're 18 have actually given birth. And many of these are women who have not been particularly well nourished, who are not particularly well educated, who may not have the knowledge they need to maintain their own health or try to ensure the health of a young child. And this is a major issue, especially in some countries and some regions, for the health of adolescents. HIV/AIDS also extremely important to adolescent health. In fact, there are 2 million adolescents in the world today who are HIV positive. And in some countries, up to 60% of the new infections occur among people who are 15 to 24 years of age. It wouldn't be surprised, and this is communicable diseases, it wouldn't be a surprise in environments in which the rates of HIV prevalence are high to also see that tuberculosis, which is an opportunistic infection of HIV, often goes hand in hand in those settings. And an important number of adolescents are actually infected with tuberculosis. This is non-communicable diseases, and we've talked a little bit in the vignette about the fact that an increasing share of adolescents in the world are actually overweight and often obese, and are more and more being exposed to the risk factors that relate to this growing amount of overweight and obesity. Now, it's been estimated that 10 to 20% of all the adolescents in the world suffer from mental health conditions. And we've already seen in the graphic on disability-adjusted life years the exceptional importance of mental health to the overall health of adolescents. Interpersonal violence we also saw, and it's in some regions of the world, this is more important than in others. And in Latin America and the Caribbean region, interpersonal violence is the leading cause of death of adolescent males. And finally, we know that as children become upper adolescents, they get more and more exposed, especially in places that aren't able to manage very effectively road safety, to road traffic injuries. Now, there are a number of measures that can be taken to enable better adolescent health, and several important approaches that have been recommended for how one might think about and deal with adolescent health as well. One is the importance of taking a life course perspective, and that is to think about adolescents, as we've seen in the graphics, and the conditions that they face, the risk factors they face, and the burden of disease as it evolves from their being younger adolescents to upper adolescence. Second, we know that the health of everyone has to do with what we call social determinants, but this is really especially important as well for adolescents. What are the circumstances under which they're living? What is the environment in which they live? What is the extent to which they can avail themselves of education? Or by contrast, they're just kind of hanging around and exposed to a variety of things like tobacco, alcohol, and substance abuse. What's the extent to which they have access to jobs that can help them move ahead in ways that will allow them to be all that they can do? All of these have an impact on health. And when we're thinking about adolescence, it's very important to keep in mind the social determinants of health. We've talked repeatedly about auto injuries, and there are a number of measures that countries have taken to try to ensure that adolescents are better trained to get in a vehicle, that they are less distracted when they're in vehicles, that they understand how to drive under different weather conditions, and that they don't get to drive with too many kids in the car or other people in the car, for example, until they pass certain milestones in age or in experience in driving. And there's evidence that these measures can work to reduce road traffic injuries among adolescents. We also know that a number of health services aren't really set up to deal with adolescents. Adolescents have particular needs. They're a particular age group. We've talked about, and Rachel was kind enough to comment very nicely about what's so special about them. Adolescents need to be comfortable coming to health services, seeking health services, learning from those health service providers what they haven't learned elsewhere about appropriate health behaviors. And just like UNICEF created baby-friendly hospitals, it's really important for health systems to make themselves places where adolescents can feel comfortable and welcome and wish to come when they need either services or knowledge to try to maintain a healthy life. Now, it's really important as well, of course, to focus on reproductive health, especially among upper adolescents, but younger adolescents are often also very much need to understand reproductive health issues and be prepared for the life to come. It's really important to try to create an environment that enables children to stay in school, thrive in school, seek well-paying employment after that, and to avoid the risks that come with early and unprotected sexual relations, early marriage, and early childhood. Now, having said this, it's also important to note how we must also focus our attention not just on reproductive health issues, because in some places, that's really all they talk about. I'm exaggerating slightly for effect. It's really important to see the adolescents as people as a whole, and not just, forgive me, to focus on reproductive health issues, but also to focus more broadly on these other burdens and risks that we've talked about, including their needs to be well-nourished, their need to be immunized, HIV, tobacco, substance abuse, mental health issues, which are so critical, and to try to encourage them to eat well, be physically active, and drive in safe and prudent ways. Now, one could speak much, much more about adolescence, but let me end by saying we've seen that adolescents are a group from 10 to 19. We also understand that their health is exceptionally important to maintaining the gains that have been made in the health of children, but also to trying to set a foundation for having healthy adults later. We know more than we did before about the leading causes of death and DALYs among these groups and how they vary by age and by sex. And we also understand, hopefully more than before, about the exceptional importance to adolescents of mental health issues, iron deficiency anemia, which is really critical as we saw, HIV, and along with mental health issues, self-harm. To address adolescent health issues, we have to take a life course approach. We have to keep in mind the social determinants of health. We need to focus on reproductive health, but we need to think about more than that as well. And we need to do so in settings that hopefully are friendly to adolescents and encourage them to do all they can to be healthy in an environment in which people understand who they are and try to be as helpful as possible. In the next session, we'll speak about complex humanitarian emergencies, natural disasters, and their relationship with health.